Ramaphosa also faced questions about South Africa's slow COVID-19 vaccine rollout. Government is aiming to inoculate 67% of the population. It's around 40 million people. That's in order to achieve herd immunity. Ramaphosa adds injections for 41 million people have already been procured.
Vaccinate 41.5 million people. The estimated times for the delivery of the vaccines depends on several factors, many of which are beyond our control. The contractual delivery schedule, as per the information shared by manufacturers, is as follows, as you wanted to know. In Q2 of 2021, we are scheduled to receive 3 million Johnson & Johnson doses, 4.5 million Pfizer doses from our contract with Pfizer, 1.4 million Pfizer doses through the COVAX facility. In Q3, as you wanted to know, we are scheduled to receive 9.1 million Johnson & Johnson doses, 8.5 million Pfizer doses. In Q4, we're scheduled to receive 19.1 million J&J doses, that is Johnson & Johnson, and 7 million Pfizer doses. In total, we are therefore scheduled to receive 31.2 million Johnson & Johnson doses and 21.4 million Pfizer doses, including the COVAX allocation that we are entitled to.
The coronavirus pandemic has revealed just how interconnected the world really is. Health Minister Dr. Zweli Mkhize says while he shares the worries of variants coming into South Africa, we are capable of dealing with the issue. They speak now about whether South Africa is ready to handle a potential third wave. We're joined by Wits School of Governance Professor Alex van den Heever, and also part of the conversation, University of KwaZulu-Natal Acting Deputy Vice Chancellor of Research and Innovation, Professor Musa Moshabela. Good evening to both of you, and thank you so much for your time. So we're hearing again resurfacing fears of a third wave as we get into the winter months especially. And the big question is really whether or not we've done everything in our power to prevent the kind of peaks that we have experienced before. Alex, you can go for it.
Yeah, I think that we've got a lot of experience about how to address a wave if it does occur. It would be important that we try and address it as soon as possible if we start to see it happening. But we're never far away from it occurring. So it's not as if some model is going to generate an indication of when it will happen. It really depends on whether or not we've got these super spreading events that ignite a wave, and whether or not we've got a general build-up of complacency that is causing people to think that the problem has gone. The problem has not gone. And but if we see a third wave, it's not going to be because of the Indian variant. It's largely going to be because of the super spreading events that aren't being managed.
Professor Musa?
Yeah, Kathy, greetings to you and the viewers. My view is that we have not done enough to conscientize South Africans and to prepare them. I think that we became comfortable knowing that we are in the trough of the waves and things are kind of stable. And we could also then see how society was beginning to react to that. You know, a lot of people forget that we are still in alert level 1, masks are still compulsory, we should not do social gatherings. And we haven't really seen any sort of punitive action towards all these publicly witnessed social gatherings. However, I do think that in order to brace ourselves for this third wave that we are beginning to see some sort of early signs of, it becomes important for South Africans to be ready for it. A lot is going to depend on behaviors of people as individuals and also as groups.
Are we looking at a situation where in the long run, well, maybe not the long run, because the timelines we're working with here are really differences between weeks and maybe months at most, but are we looking at a situation where we could very well begin to see things change in terms of the COVID-19 figures without necessarily having a new variant circulating in the country? Professor Alex?
It's possible that we have certain levels of immunity that have built up already that would impact on the current variants in South Africa. And that might, quite aside from human behavior, might have a limiting effect on the extent of any kind of further waves that we experience. But people who were infected in the first wave, for instance, might have lost some of their immunity to infection and transmission. Even if they're not going to be susceptible, they're not going to get severe illness, but they will be able to transmit it. So those people who were not infected at all in the past would then be vulnerable to transmission even from people who were infected before. So there is that risk, which is why we do have to manage behavior quite carefully. Down the line, we're going to have to have a combination of restrictions and vaccinations and revaccinations as we move forward for a number of years. And we still don't have a complete picture of how immunity will build up. We really just have a number of assumptions about how it would work based on experience to date. But I think it's highly probable that we will build up immunity over the next 2 to 3 years, and we will see a gradual decline in the risk of transmission. But it's that transmission versus severe illness that is an important effect that we are unsure of. We're pretty sure people who got infected probably won't have severe illness, but we don't know whether or not they will transmit the virus.
Professor Mshabela, Alex raises the issue of restrictions going forward, and it's been very contentious, the issue of government implementing restrictions, whether it's the best way to go. Now that we've had a bit more time to analyze the data, but also look at what the rest of the world does as it goes through the various phases of COVID-19, are restrictions a sure-proof way of delaying the spread of infection of COVID-19?
That's a difficult question and a contentious one, of course. But I think that at this point we have learned enough that it's important to balance public health with, economic interests, and it's something that we cannot ignore. And in a way, because we are in this for some time, in this journey for a long time, it's important that we begin to find a good balance whereby, we can continue to function as society and still maintain a degree of control in terms of the pandemic itself. I think the lesson that we have learned from the second wave, it's really important. We're dealing with a highly transmissible variant. And this is the variant that is still dominant in South Africa. I think we should not forget that in South Africa, we still have a highly transmissible variant in terms of B1351. And we were able to bring it to some control even before we started our vaccination rollout, using a combination of behavior interventions as well as some restrictions, whatever was, the balance of alert level 3. And of course, we are more comfortable with alert level 1, provided that people are adhering to behavioral interventions. I do then think that, Kathy, that the lessons we have learned is that when we do find a good balance between the risks in the pandemic and the measures of restrictions and behavior interventions, we are able to bring a certain degree of control. It's just that it's not sustainable long term. We do need to move into a space where we vaccinate a large majority of the population. And even though we might be exposed to new variants, at least we can prevent severe disease, hospitalization, and death through the mass rollout of vaccination. And then we can limit the extent to which we restrict society in terms of its function.
When it comes to government's ability to procure, well, not just to procure vaccines, but to also have an effective vaccine rollout, Are there particular areas that you are looking at to gauge the state of readiness for a scale of vaccinations that needs to take place in order to meet some of the targets and perhaps achieve herd immunity? Professor van der Heever?
I think that it would be ideal if we were hitting 300,000 a day. And I think that that's possibly feasible over a period of time, because I think we're going to have teething problems as we begin. I mean, there are lots of things that can go wrong in the initial phases, but it doesn't look like we're getting the doses fast enough that we can scale up to that level. So it's really a question as to whether or not we start getting doses that allow us to move up to a real scale that is appropriate for our environment. But I think that we can do more than we're getting at I mean, obviously we've got nothing at the moment. But from mid-May, we're meant to have vaccines, and we will probably start low and expand. But we're going to have to expand quickly. And there is a sense that I have that there's flexibility in the case, for instance, of Johnson & Johnson to provide more vaccines in South Africa faster if we scale up faster. But if we don't scale up faster, we'll export the difference. So I think that that's going to be our problem down the line. But initially, we're restricted by both doses and scale. But if we don't get scale up to 300,000 a day, the difference is going to be exported for those vaccines that are being finalized in South Africa from the Quebec plant.
Professor Moshabela?
Yeah, I would like to agree with that. I think I have moved away from the long-term targets to focusing more on what we can do on a daily basis. I think that's the target. Those are the targets we have to monitor. If we can monitor how many people we are able to vaccinate on a daily basis and aim to optimize those targets to about 250,000 to 300,000, then we might actually have the hope of achieving the long-term targets. I also think that one of the things I would be interested in seeing is the extent to which the private sector begins to participate, as well as the sort of workplace environments. You know, the environments outside of the healthcare facilities. In rural communities, it's going to be interesting to see how much can be distributed in terms of vaccines outside of health facilities in order to improve access. Those implementation processes, for me, are going to be really important in driving up the demand as well as coverage of vaccination on a daily basis.
All right, let's leave it there for tonight. Thank you both for your time. Professor Alex van der Heever from the Wits School of Governance and Professor Musa Moshabela from the University of KwaZulu-Natal.